Today, we're going to talk to Dr. Jason Hitkari, a reproductive endocrinologist over at Olive Fertility Center. They're located in British Columbia, Canada. And this is a follow-up to a blog I did in December 30th of 2021, where I talked about how many eggs to freeze based on your age to assure success. So we're going to review a little bit of that with Dr. Jason Hitkari. But in that blog, and you can check that blog out at acubalance.ca, I talk about this technology called Violet, that it's artificial intelligence, AI, that Olive is using to help assess the egg quality when they freeze the eggs to give you an idea of your egg quality. So let's go and talk to Dr. Hitkari. I'm sitting here with Dr. Jason Hitkari. He's one of the co-founders and co-directors of Olive Fertility Clinic, and that's located in British Columbia, Canada. He's a medical doctor, OBGYN, and he's also a reproductive endocrinologist and infertility expert. Dr. Hitkari, welcome.
Hey, thanks for having me.
Let's talk about egg freezing, because in the last decade or more, since around 2009, the freezing technology, vitrification, has allowed you guys to do a much better job at freezing and thawing eggs at a later date.
Yeah.
We're getting a lot of questions about egg freezing in general and how many they should freeze. So I thought we would talk about that. And why do women come to you? What are the reasons they're coming to you to have egg freezing done?
There's quite a few different reasons why people come. I mean, we kind of break it down into two general areas. One is some people have a diagnosis that makes it important for them to freeze eggs, like cancer. Cancer diagnosis would be a good example of that, where they might need to face chemotherapy or other treatments that would affect their egg health, and in fact could sometimes render people menopausal. So they want to get eggs out before they get this treatment. For cancer would be the classic example. But more and more people are doing what we call elective egg freezing, which is when they want to freeze their eggs to basically preserve their fertility for the future. Because I think we've done a better job as the years go by, trying to educate people about the impact that aging has on egg number and egg quality. And I think people are really paying attention to that and saying, well, maybe I want to take more control over this and freeze eggs for future use. So that's what we would call elective egg freezing.
And this is for, like, for example, somebody is going to pursue their career and they don't want to have children in the 30s, but maybe in the 40s, they can freeze their eggs in their 20s or 30s with the hopes to start that family later.
Yeah, exactly. Whatever reason, exactly. A good example, like trying to finish your education. So we would often see, for example, physicians here who are saying, listen, I've got another 5 years of this training and 2 more years of this training. I don't think I'm going to start my family for quite a while. And we say, okay, well, that would be an example. Yeah. So whether it's you just don't know where life is headed, or you've got career aspirations, or whatever kind of psychosocial things that are happening in your life that make you want to take more control over your reproductive health and options.
And when you think about it, like, men can father children much later in life than women. And so a lot of women probably have settled, like they married that guy because he's the best thing and they got to have a family. And now they can wait for Mr. Right. I guess I'm fortunate now that I'm married to have kids, but I might have been one of those people. My wife would have said, I got my eggs on ice. I'm not going to wait for you.
You're right. Well, it does give you freedom, right? I mean, it does give people freedom, I think, to make those life decisions about about partnership and take a bit more control. I mean, I will say that egg freezing is, it's not 100% successful. And so I really do think people need to be a bit cautious about assuming that if you've frozen eggs, you've kind of secured a guaranteed, pregnancy or baby in the future. It doesn't really work that way, but at least it gives them many people a good option and a good chance in the future. Yeah.
So I don't want to get there yet, but we're going to talk about the technology that you guys are using at Olive. I think it's called Violet, where you're using AI to kind of assess the egg quality. Before we go there, though, you just said something about, it's not guaranteed. And, you got embryo freezing that you do at Olive, right? They freeze embryos, and there's egg freezing. And so some women think, I got 5 eggs, but that's not the same as having 5 embryos.
No, that's right. And it goes down to the physics of things. Like an egg, I know it seems a bit like particular, but an egg is quite a big cell, and it tolerates the freezing and thawing process, but it doesn't like love that process. It's a bit harder on a single cell that's quite large. It's not this big, but it's bigger than a lot of cells in a person's body. While an embryo is a multicellular structure that's actually just technically a lot tolerates the freezing and thawing quite a bit better. And so, yeah, you would do much better with 5 embryos frozen than 5 eggs. Yeah, yes.
Not every egg becomes an embryo. Not every embryo becomes a pregnancy. Not every pregnancy becomes a live birth. So
right.
When they're looking at numbers, because and I'll bring up on our screen here, because you guys at Olive had put out a publication a while back, but kind of like how many eggs women should freeze, and then we can get into your the technology, because right now my understanding is when women freeze their eggs, it's hard to tell whether they're good quality or not. You kind of assess it based on their age, and we know not all 35-year-olds are equal biologically, chronologically 35, but their egg quality could be different, right?
That's true.
As you mentioned, with age, quantity and quality does decrease. And so can you kind of share the two things? One is kind of what you're looking for based on age, like how many eggs they should be banking. Maybe they'll likely need more than one cycle if that's what you're seeing in your clinic. And question two is kind of what's this new AI that you guys are using to help you assess how many of those eggs look good right now? And I'll preface that you're not saying that because it looks good, they're guaranteed they're going to get an embryo and a baby, but at least you're able to kind of give them a little bit more assurance based on what you're seeing.
Yeah, I think that's really well said. I mean, egg freezing is a bit of a numbers game. It definitely is related to the person's age, because age affects egg quality. It's related to their underlying health, and I think that's where allied health professionals can help, like try to improve people's underlying health in an attempt to give the healthiest eggs possible. And then what it comes down to also is the number of eggs. Like the more eggs that you get, the more likely that those eggs will result in a live birth. So what you're sharing here is a good example of that. Like women under 35, if you're able to freeze 15 eggs, it will give them about an 85% chance of a live birth. That's great, but 15 eggs is actually a quite a large number of eggs, and some people aren't able to produce that many. We're only able to get 8 or 11 or 12, and so I think there needs to be taken into account sort of what a person's ovarian reserve is like. So, for example, when people walk in, they often don't right away say, like, I want to freeze my eggs. They'll often come to the clinic and say, I kind of want to know where my fertility is at. And we do an assessment and some tests and talk and get a history. And we're really focused on what their ovarian reserve is like, because we really want to make sure that they have a normal number of eggs for their age group, and not fewer than you'd expect. But yeah, this is a very good kind of general way of looking at things. Like if you look at women who are 40 to 42, freezing 30 mature eggs gives them about a 50% chance of a live birth. That sounds really great, but getting 30 eggs would be a lot to get from someone in that age group, and that might take 3 or 4 rounds. Depending on the person, to get like 30 eggs, that would be a lot of effort probably, and maybe in some regards for most people a bit unrealistic, because it's expensive to do too. So anyhow, it gives you a bit of at least this data gives people a bit of a feel for how age impacts the chances when you're freezing eggs. Yeah.
And this chart is in a blog that I did, and it's dated December 30th, 2021. How many eggs to freeze based on your age to ensure success. So if you want to look at those numbers, you can go in and review that there. I want to let you know it's there. And in this, it was in December of 2021 that I introduced that Violet is being available through Olive. And so can you share a little bit about what it's about, what you're seeing, and go from there?
Well, I think it's really important, because when we get a person's eggs out and we have them frozen and we speak to them, we say, we have 10 eggs that are frozen, and they'll say, well, how are my eggs? And historically we would say, we don't really know. I mean, they looked okay, but right away we put them in the freezer, and so I don't know, they look pretty good. And you have 10 eggs, and we would go to those charts like you have in the blog and say, 10 eggs, this gives you a such and such chance. But the desire has been to be able to counsel people more accurately about what their eggs actually look like. And so Violet is a way of actually taking a two-dimensional photograph of each of the eggs that we've collected and running it through a computer algorithm so that the computer, based on historical data, can say, okay, this is actually a nice looking egg that has a high chance of producing a high quality embryo, or this egg does not look very good. It's very unlikely to result in a high quality embryo. And if you think about it, what that does is allows us to personalize for an individual. Now that we have your eggs, what is really the potential of what we have frozen? Not just base it on age and numbers, but personalize it based on how the eggs actually looked. It's very powerful, retroactively, but powerful.
And because it's AI, this camera is just an incredible power for getting close up versus what we can look under your microscope.
Yeah, absolutely. It's completely driven by, it's not subjective, like somebody in the lab looking with their eyes, although our embryologists are excellent at doing it, there's some subjectivity to it. So yeah, using images and computers to analyze and put it through these images through an algorithm is and it's better, and it gets better and better with time, right? Because like anything, with computer learning, as they get more and more larger and larger data set, the accuracy of the Violet process improves. Yeah.
And then at this stage of us recording, women have been freezing their eggs, and there are clinics sharing, starting to publish data of them thawing them and going in for the dissemination for the to make embryos.
Yeah.
Where are you guys at? Are you starting to see women now that have frozen their eggs come in and do their IVF to get the transfer in? Have you gotten to that place?
Yeah, so you raise a really important point, right? Is that we haven't been doing this forever. Like it's only been the last, and I lose track, 7 or 8 years or so that we've been really collectively as a field freezing eggs. And so you're right, a lot of those people for a long time didn't come back because you freeze your eggs so that you can use them 5 or 10 years later. And so it's only now that clinics are having people coming back and starting to thaw their eggs. And I would say generally, that the process is working as well as we'd expected. Yeah, and we're getting good results from the eggs that we've frozen. Yeah,
that's great news, because again, you freeze the eggs, and you have a theory of how they should turn out, and now you're starting to see you're making pregnancies and babies, which is great news.
Exactly. And it's nice to have the Violet because it also gives people a really clear picture based on their individual eggs appearances, what their potential of those eggs is.
If I put myself into one of my patients' shoes, what I'm liking about Violet is, how many IVF should I do? Like you said, if I want to get so many eggs to increase my insurance, and I got 8 in a cycle, and you're saying, wow, Violet says these 8 are excellent. I may not feel like I need to do another cycle, but if I get 8 and Violet says we got 1 and the rest don't look good, that may give me a reason. And so now, rather than just going based on general odds, I'm getting more individualized assessment. It looks like.
How well, that is super well said, because in practical terms, that is exactly how you use it. You say, wow, your eggs look better than we would expect in your age group, and maybe we can stop. This may be enough of an assurance for you, or vice versa. If the eggs don't look good, it might even change what they do in their personal lives. I might say, okay, well, I'm going to go and try to conceive on my own more quickly than I'd anticipated. Or if they're, professional, and they're trying to do a lot of education, might say, I'm going to take a break and try to get pregnant now instead, or maybe freeze more eggs. Exactly. Like it gives you more information, and I think that's really helps people make decisions.
I have an idea here, because we do a lot of integration with you guys over at all of AcuBalance, and our role is to help maximize the egg and sperm quality to make hopefully good embryos, right? Healthy babies with healthy egg plus healthy sperm. Sometimes people have to go through or choose to go through more than one IVF cycle. And it would be neat that when you guys are retrieving the eggs, if we do our treatments for those 100 days, if you have a patient that hasn't had treatment, you take a picture of their eggs. And then if they have to do another IVF cycle, we do our program, and then you take photos to see if you're seeing anything different based on Violet. That would be
your point is a good one, which is that now that we can get more specific data about the health of the eggs, we can actually study what changes egg quality in an individual. But I would say my approach should be generally is to assume you're one, as a patient, I'd say, assume you're just going to do this once. Go do all that work to improve your health and egg quality before we even do the first round. But your point, your scientific point is a really good one.
Be a good study.
Yeah.
And again, see, it's nice to see where integration is at the time of this recording, 2022. We're having a reproductive endocrinologist say, hey, do the preconception care first. Usually that would be what I would say, but it's nice to hear that you're saying.
Yeah, because we all want to, do the most to get the success the quickest that we can, and whatever we're trying to do, whether it's freezing eggs or making embryos and babies at the time. Yeah, I don't know. As a philosophy, people should really think about optimizing everything. Really, I don't know why you wouldn't.
So for those that are interested in egg freezing and have questions, they want to know about egg freezing, do they need a referral first to contact you guys, or can they set up an appointment where they can ask you questions about egg freezing? What's the process for somebody that's watched this video and they're interested in knowing more about egg freezing and how to get in touch with you guys at Olive?
You really do want a personalized assessment. So you really should get a referral to a fertility center, because like I said, there's other testing involved, like knowing what your ovarian reserve is like, which we easily figure out with a blood test called AMH that you may have heard about. So I know the appeal for just saying, I just have a few questions to ask about this, but really what we want to accomplish is as fertility physicians is a really personalized assessment to say, listen, you're 32, you have a lot of eggs, maybe we just see what happens in the next year. Or you're 32, you don't have a lot of eggs, we're a bit worried, maybe we should free. Like, you really want to get personalized answers to your questions. So yeah, you should get a referral and then see a fertility physician for a full assessment. Really, that's the best thing. Yeah.
So if people are in Canada, my understanding is they get a medical doctor referral because the insurance MSP will cover the testing. What about people that are outside of Canada? Are they able to contact you guys?
Yeah, they are, but unfortunately for people outside of Canada, they don't get coverage for medical consultations, so they'll have to pay privately for a consultation. But yeah, we see many people from the US, for example, and other places, and so you're happy to see people. Yeah.
Excellent. So for the preconception care, you can contact us at Acubalance. We'll help you hopefully get your eggs to their peak fertility potential. And then for the egg freezing and the assessment and getting your eggs frozen and all those questions that you want to get answered from Olive and Dr. Hitkari, you can get your medical doctor to refer you to Olive Fertility Center. Dr. Hitkari, thanks for this enlightening conversation, and I look forward to hearing more about the technology that I know you're passionate about that you guys are using in your fertility center.
Yeah, thanks very much. A pleasure always to talk to you, and yeah, that was fun. Happy to have done this. Thank you.